Hi, I have a question. Who is the best OT in this forum? Please raise your hands. The best one. So much of doubt.
We are all here.
Wonderful. Secret ingredients to quality excellence in occupational therapy. Namaste, Namaskaram, Kochi. I'm Dr. Saril from Sakra World Hospital, Bangalore. Sakra World Hospital is a joint venture of SECOM and Toyota Susho, Japan. This is the first hospital anywhere in the world by Toyota, and the other three hospitals are in Japan. Today, I'm incredibly proud to present an organization called CAHO, Consortium of Accredited Healthcare Organizations. Let's dive into the topic. I have a few questions, and I really appreciate an answer from each of you. What is quality of care? According to World Health Organization, quality of care is the degree to which health services increase the likelihood of desired health outcome. Now, a high quality occupational therapy should be effective, safe, people-centered or person-centered, timely, equitable, integrated, and efficient. Who decides what is a good quality in OT? Can you answer that? Exactly. Your client, your patients. Thank you for the answer. Nobody else can decide what is a good quality. Now, hypothetically, let's think the worst occupational therapy center in the world. Hypothetically. None of us want to be there, I'm sure. But just imagine the worst occupational therapy center. What would you find there? What all things could happen there? What is the worst case scenario? Any answers? Louder. I can't hear. Professional damage. Okay. Not coming up to the expectations of the client. Wonderful. So let's see, there are a lot of them. Increased waiting time, appointment canceled but no communication, lot of falls or infections, broken therapy equipments, lack of training and upskill facility, silos work culture that everybody are fighting between each other in a rehab center, patient complaints not addressed. Now, a million of these problems happen. All of this can lead to poor results, injuries and infection, dissatisfied patients, staff frustration, and finally they leave the organization. Poor organization image, legal consequences, and finally loss of business. How many of you would you like to work in this kind of an organization? Anybody? No. So what is that we can do to ensure that there is a quality assurance that you give to your patients? What are the ingredients to quality excellence in occupational therapy? Let's see one by one, and I'll make it very quick. Occupational therapy capacity building. OT empowerment is the most buzzword now. It's time, OT, stand up for yourself. Your opinion is heard and an action is taken based on your opinion. And you lead the whole team. There should be role clarity, something we call it as job description, career ladder, rewards and recognition. Very important aspect is your documentation standards. And many of you in college would do things better, but once you start working, we are too busy to do, with documenting things. So there should be a policy, standard operating procedure. Clinical care pathways must be developed based on research evidence, and we should follow that. Registry, it's time a national registry is available for India. Effective communication strategies. You could use evidence communication tools like AIDET, ISBAR, Spikes, communication skill training, and interdisciplinary team meetings. Extremely important. We all should be talking to each other first before we communicate to the patient. Facility upkeep, bad news first culture. This is something that we profusely practice as a policy. Positive incident reporting. Kaiken Yochi is a Japanese concept for hazard prediction. Nothing happens to the patient, but even before that, you start predicting and you start taking action for the hazard. Photo-based Kaiken Yochi, HERA, FME, these are all various tools that we would be, like to address in such kind of a forum. Another important aspect is 5S for lean management. And another Japanese concept is reducing muda. Muda is nothing but waste. Now, there are 7 types of waste according to Toyota, but there is an interesting waste, 8th type, which I really like to work on, is not utilizing an occupational therapist intelligence. The intelligence gets wasted. You do your BOT, MOT, but in the end, you do not really give them a respectful position in the organization, and they are always been unheard of. So what happens if they don't do research? If you no longer work on your aspects, then your intelligence is getting wasted. No, we should avoid that kind of a situation. So those are the 8 types of muda according to the principle. Anzen first is the Japanese concept for safety first. Avoidable harm should be eliminated. These are the 6 patient safety goals internationally. And most important one in that, in any organization, is prevention of patient fall. And as occupational therapists, we are the best in the world to lead this particular facility to prevent the patient fall. Emergency preparedness is at most importance. Many a time in India, we take safety for granted. Right outside this podium, if you just walk around, there are a lot of cables, lying around. So safety somehow, somewhere human life is not valued, is what I feel sometimes. But it's time we take things into our hands and turn things around. So we should have mock drills, emergency codes, crash cart is quite essential. Patient centricity or a person-centered care. At CAHO, we have started something called Patient for Patient Safety Initiative and patient support groups. Is there anybody over here who drive a support group? Can you please raise hand? Please do. Thank you. Thank you, ma'am. It's a wonderful initiative to really include your patients and caregivers and make them also as empowered as you. Quality indicators. Develop a lot of quality indicators to measure your success. I asked a question in the beginning. How many of you are the best OT? How do you measure it? It's time nationally we have measurement tools by which we know that there are a lot of quality measurement tools. Something we call it as key performance indicators. And one of that I can give example is Canadian Occupation Performance Measure, COPM, and a lot of them which is listed out here. And what do we do with these measurements? Either you do a clinical research or you do a clinical audit. What is the difference between these two? Clinical research tells you a theory. This is how it should be done. But are you really doing it? How do we know that we are doing it? So we measure our standards against the structure, process, and the outcome. And that is the clinical audit. And it's time we have enough clinical audits coming up from across the globe from occupational therapists. And all of this will lead to what we call as Kaizen. Kai is change and Zen is good. So change for good and continuous quality improvement. Please get your ground level staff, even if it's students, get all of them to do something called quality circle. Develop a lot of these are just examples that I've listed over here. You can start any of these activities in your center. For example, a snoozle and multisensory environment. And you can just have the ground staff driving it. And that's called a quality circle, PDA cycles. And we do what is called as continual improvement. So to sum up, documentation standards, capacity building, Anzen first, clinical audits, KPIs, patient centricity, Kaizen, and quality circle. These are a few secret ingredients that I can share with you in the short span of time for quality assurance. Now, I have a very important question. Who do you think should lead quality in rehabilitation services? Who do you think? PMR doctor? Physiotherapist? Medical social worker? Who do you think should lead quality services in rehabilitation? Any answer? Occupational therapist. Thank you. Thanks a lot. How many of you agree with that? Please raise your hands. Wonderful. Most of you are still sleeping. Good morning. So quality is a journey, not a destination. Now there's one last secret that I kept it a top secret. Last but not the least, technology empowerment. That is the future, my dear friends. I have a beautiful video which is taken by our occupational therapist at Sakra World Hospital, Bangalore. Please watch this video. We have the consent from the patients, but please do not share it in the social media yet. Okay. So this is technology improvement in occupational therapy. Sound, please. My dear friends, thank you so much. This is presenting to you the secret ingredients for quality in occupational therapy. Thank you so much. Namaskaram, Kochi.
I invite Dr. Murali Krishnan sir to felicitate the guest.